Picture this. Your beloved furry friend, the one who's always there to greet you, suddenly starts squinting.
Yeah, or maybe pawing at their eye.
Exactly. And something just doesn't look right. It's a really worrying sight for any pet owner.
It absolutely is.
Today, we're taking a deep dive into a condition that can cause exactly this kind of distress: lens luxation in animals.
What's kind of fascinating, well, maybe concerning is a better word, about lens luxation, is that it's a problem with a tiny, crucial part of the eye, the lens just becoming, well, dislodged.
Dislodged, okay.
Yeah. And, this isn't just a minor inconvenience. It can lead to significant pain and even vision loss.
Wow.
So understanding what's happening is really important for you as a pet owner.
Absolutely. So to get a clearer picture of this, we've looked into a veterinary resource. It details the ins and outs, really.
From signs to treatment, the whole thing.
Right. Our goal today is to pull out the vital information, the stuff you need to know, to feel informed and ready if you ever face this.
Without getting totally bogged down in the medical jargon.
Exactly. So let's start with the basics. What exactly is lens luxation?
Okay, so luxation, the word itself means a complete dislocation.
Complete. Okay.
Yeah. And when we talk about the eye, we mainly see this in two ways. There's anterior luxation.
Interior.
That's where the lens moves forward. It actually passes through the pupil and ends up in the anterior chamber.
That's the space right at the very front of the eye?
Exactly, the fluid-filled bit. Then we have posterior luxation.
Which would be backward.
Right. The lens moves backward and sort of sinks into the vitreous humor.
That gel stuff that fills the main eyeball?
That's the one. So, yeah, it's a complete shift in position.
So the lens totally moves out of its normal spot, either forward or back. Now, the resource also mentioned subluxation. What's the difference there? It sounds, well, less extreme.
That's a pretty good way to think about it, yeah. Subluxation is a partial separation.
Partial. Okay.
The lens hasn't fully dislocated. It's still attached to some of those tiny fibers called zonules.
Those are what normally hold it in place.
Precisely. They keep it centered. So with subluxation, the lens might still be kind of in a normal or near normal spot within the pupil, but it's unstable.
Like it's loose, wobbling.
Kind of like it's wobbling, exactly. Not securely held anymore.
Okay. So luxation is the full escape. Subluxation is more like it's threatening to move. That makes sense.
Mm-hmm.
Now, our resource also breaks down the reasons for this. It mentioned primary, congenital, and secondary types.
Right. Those categories help understand the why.
Can you walk us through what those mean?
Sure. So primary luxation often happens because the zonular fibers we just mentioned, they gradually weaken. They break down over time.
Just on their own.
Well, what's particularly interesting is that this is frequently inherited in dogs.
Ah, genetic.
Yeah, passed down through their genes. And it usually affects both eyes, though maybe not at the same time.
Okay, that's primary. What about congenital?
Congenital luxation is usually linked with other birth defects.
Yeah.
Things present right when the animal's born.
Got it. And secondary?
Secondary happens because of something else going on in the eye. Another problem or maybe trauma.
Like what sort of problems?
Oh, things like chronic inflammation inside the eye, tumors growing in there. Even just the aging process sometimes can weaken those delicate zonules.
Okay, so primary is the genes, congenital is birth-related, and secondary is a knock-on effect from something else.
That's a good summary, yeah.
That helps clarify it. Now, who typically gets affected by these different types? Are there specific animals we should know about?
Absolutely. Primary luxation, it has a fairly specific profile.
Oh, yeah.
We tend to see it in adult dogs, usually between, say, 3 and 8 years old.
Okay, middle-aged dogs.
Right. And certain breeds are definitely more prone to it.
Which ones?
Various terrier breeds are common culprits. Chinese crested dogs, Shar-Peis too.
Interesting list.
It's also worth mentioning that primary luxation is actually pretty rare in cats.
Oh, okay. So mainly a dog thing for the primary type.
Predominantly, yes.
Mm-hmm.
But secondary luxation, that's different. It doesn't really discriminate. It can happen in both dogs and cats. Any age, any breed. Because it's triggered by those other underlying conditions we talked about.
Right, the inflammation or tumors or whatever else is going on.
Exactly.
So if you have one of those predisposed dog breeds in that age range and they start showing eye trouble, well, primary luxation might be high on the list for the vet.
It certainly would be something to consider, yes.
Now, what are the actual signs? What might a pet owner see at home if their animal has this lens instability or a full luxation?
This is where being observant really helps. With lens instability and subluxation, there are some subtle but important things.
Okay, like what?
You might see what are described as fibrils of liquefied vitreous. They look like tiny wispy strands floating in the fluid at the front of the eye. The anterior chamber itself, that front space, might look abnormally shallow or deep. The iris, the colored part,
Yeah.
it might have an unusual curve to it.
Yep.
Then there are more noticeable signs, perhaps. Phacodemesis.
Fuck a what now?
Phacodemesis. It's basically a visible trembling or shimmering of the lens when the eye moves. You might not see the lens itself, but the pupil area seems unstable.
Like it jiggles.
Sort of, yeah. And similarly, iridonesis is a tremor of the iris itself.
Wow.
And finally, with subluxation, you might spot an aphakic crescent.
A fake crescent.
Yeah, it's a little crescent-shaped gap in the pupil where
Yeah.
you can see past the edge of the wobbly lens.
Those are some very specific things to look for. What about when the lens has fully luxated, forward or backward? Are the signs different then?
Well, interestingly, a full luxation can actually have many of the same signs as subluxation.
Oh, okay.
But what's really crucial, absolutely crucial, is recognizing when the eye becomes painful.
Painful how? Like obvious pain.
It can be. It might come on suddenly acute pain or be more of a chronic, ongoing discomfort. You might see redness in the white part of the eye.
Okay, bloodshot.
Yeah, vents call it episcleral injection. At a cloudiness of the cornea, the clear front surface.
Like a haze.
Exactly, corneal edema. It might cover the whole cornea or just be sort of central.
Yeah.
Squinting, tearing, holding the eye shut. Those are big clues too.
And it's not just about the immediate discomfort, right? I mean, this can lead to bigger problems.
Absolutely. Glaucoma that's increased pressure inside the eye is a major risk.
Ouch.
And it's more common when the lens luxates forward into the anterior chamber.
Because it blocks the fluid drainage?
That's often the mechanism, yes. We can also see uveitis, which is inflammation inside the eye, cataracts forming, and even retinal detachment.
Retinal detachment sounds really serious.
It is. It can lead to irreversible blindness.
Yeah,
So yeah, it's really important to take any of these signs seriously.
definitely. So paying attention and not just brushing it off as, oh, they just got something in their eye is vital.
Very much so.
Okay, let's dig a bit deeper into the causes then. We touched on the genetic part of primary luxation. What more do we know?
Well, the resource points to a link with a mutation in a specific gene, ADAM-TS17, in certain breeds.
Adam, TS17.
Yeah. This gene basically gives instructions for making a protein, and that protein is key for maintaining those nodular fibers that hold the lens.
So a faulty gene means faulty fibers?
Essentially, yes. Weaker fibers that are prone to breaking down. But it's important to know, the exact inheritance pattern isn't always simple or fully understood in every single affected breed.
Okay.
And what's also quite interesting is this connection between primary luxation and primary glaucoma.
Glaucoma again.
Right. In some breeds, these two conditions seem to pop up together more often than you just expect by chance. It suggests there might be some shared underlying biological issues.
Joe, that's really interesting. What about secondary luxation? We mentioned inflammation and tumors. Can we expand on that?
Sure. Uveitis, that internal eye inflammation, especially if it's chronic and actually triggered by the lens itself.
Lens-induced uveitis.
Exactly.
Yeah.
That can gradually eat away at the zonular fibers. Intraocular neoplasia tumors inside the eye can cause it too. Well, a couple ways. The tumor might literally just push the lens out of place. Or it can cause chronic inflammation, which then leads to the zonules breaking down.
Okay.
Trauma to the eye is another possibility. Although it's interesting,
Wait.
it rarely causes luxation in a totally healthy eye, unless the trauma is pretty severe, like causing significant inflammation or bleeding inside the eye.
Bleeding.
Yeah, what we call hyphema blood in that front chamber.
Gotcha.
And finally, cataracts, especially certain types.
How can cataracts cause it?
Well, sometimes cataracts swell up, they become intumescent, or they start to break down and get resorbed. Both processes can put physical stress on the zonules, stretching or weakening them till they rupture.
Wow. So it seems like a lot of secondary cases boil down to something else compromising those crucial support fibers.
That's a very common theme, yes.
Okay.
Weakening or breaking the zonules.
Okay. So if a vet suspects lens luxation, what's the diagnostic process like? What are they looking for, and what else might look similar?
Well, diagnosis really starts with a good, thorough eye exam and getting a detailed history from you about your pet.
Makes sense.
And because several other things can cause a painful, red, cloudy eye, the vet needs to think about those too. Differential diagnoses, they call it.
Like what?
Other causes of uveitis, glaucoma itself, which, remember, can also be a result of luxation.
Right, chicken and egg sometimes.
Exactly.
Yeah.
Also, buphthalmia, which is when the whole eyeball gets abnormally large, maybe from chronic glaucoma.
Mm-hmm.
And certain corneal problems, like endothelial dystrophy or degeneration, can make the cornea cloudy too.
So they need to rule those out.
Correct. Routine blood work and urine tests. Usually normal in primary luxation. They'd only likely show something if there's an underlying systemic illness causing a secondary luxation.
And are there specific tests or imaging they might use?
Yes. Imaging can be very useful sometimes. If the vet suspects an internal tumor is causing a secondary luxation, they might recommend chest x-rays, maybe an abdominal ultrasound, just to check if cancer has spread elsewhere.
Raging, right.
Right. And if the front of the eye is just too cloudy to see inside properly because of that corneal edema or maybe inflammation,
Then what?
an ocular ultrasound can be really helpful. You use the sound waves to see through the cloudiness and look at the lens position and other structures inside.
Clever.
And a really crucial part of the exam is tonometry.
Measuring the eye pressure.
Exactly. Essential for checking for glaucoma. And for those breeds known to be at high risk for the primary inherited form.
The Terriers and others?
Yes. There's often a genetic DNA test available now that can help confirm that specific genetic cause.
So it's a pretty comprehensive approach to figure it all out.
It really has to be.
Okay, let's get to the really critical part for pet owners.
Okay.
Treatment. What are the options once it's diagnosed?
Okay, treatment. It really hinges on whether the eye still has potential vision.
Right, so if it can still see.
For eyes with vision, the preferred approach is often surgery to actually remove the lens.
Take it right out.
Yes, but it's a delicate operation. So, referral to a veterinary ophthalmologist, an eye specialist, is usually recommended.
Makes sense. Are there other methods besides full removal?
There are some less common ones, like sometimes they might try to manually push a forward luxated lens back behind the pupil, just manipulating from outside the eye.
Really?
Yeah, and then follow up with medication. Or for certain cases where the lens has sunk to the back posterior luxation, sometimes special eye drops, miotics, can be used. They constrict the pupil to try and trap the lens behind it, potentially avoiding surgery.
So meds might be enough sometimes?
In some specific posterior cases, possibly. But surgery is often the main recommendation for preserving vision.
What about if the eye has already lost vision, permanently blind?
Yeah, if it's irreversibly blind and, crucially, causing pain, then the focus shifts to comfort.
Options, then?
Options usually include enucleation that's surgically removing the entire eye, or sometimes evisceration. That's where they remove the inner contents of the eye, but leave the outer shell and put in a prosthetic implant, sort of a cosmetic option.
Right.
But the resource strongly emphasizes if the luxation is caused by a tumor, then enucleation, removing the whole eye, is definitely preferred, both for treatment and to get a definitive diagnosis by examining the removed eye.
That makes sense. Okay, so surgery is key, especially for vision. But you mentioned medications too, and the resource listed several. When do those come into play?
Right, meds play a huge role, both before and after potential surgery, or sometimes as the main treatment, if surgery isn't an option, or for those specific posterior cases.
Like the miotics you mentioned.
Exactly. Topical miotics drugs like democarium bromide or prostaglandin analogs like latanoprost, they constrict the pupil. So they're often used if the lens is just wobbly subluxated or if it's fallen to the back, posteriorly luxated.
To keep it trapped back there.
That's the idea. But interestingly, if the lens has moved forward and is blocking the pupil,
You wouldn't want to constrict it then.
exactly the opposite. You might use something like tropicamide, which dilates the pupil. The hope is to open things up, let the lens potentially fall back, and prevent a specific type of glaucoma called pupillary block glaucoma.
Okay, different drugs for different situations. What else?
If the eye pressure is really high, like dangerously high glaucoma,
Yeah.
they might use intravenous mannitol, a strong osmotic diuretic given in the clinic. For managing high pressure on an ongoing basis, topical carbonic anhydrase inhibitors like dorzolamide eye drops are common.
To lower pressure.
Yes. And of course, if there's inflammation present, which there often is,
Uveitis.
right,
Really?
then topical anti-inflammatory eye drops like dexamethasone or prednisolone acetate would likely be prescribed.
Wow, quite the toolkit of medications.
Yeah.
But there's a really important warning about one type, isn't there? The miotics.
Yes, absolutely critical point for owners. This is vital.
What is it?
Topical miotics, the ones that constrict the pupil, are contraindicated,
Yeah.
meaning they should absolutely not be used if the lens is in the anterior chamber at the front of the eye.
Why not?
Because constricting the pupil in that situation can trap the lens there even more firmly and actually make glaucoma much, much worse.
Oh, wow. Okay.
So it's absolutely essential that you, as the owner, confirm with your vet exactly where the lens is before you ever put miotic drops in.
Don't just assume.
Never assume. Using them incorrectly could be really harmful.
That is crucial information. Definitely something to double check. Now, what happens after treatment? Say the pet has had surgery or is on long-term meds. What's the follow-up like?
Okay, so after treatment, for those cases of, say, primary posterior luxation being managed with medication.
Demiotics, maybe?
Right, you'll need frequent rechecks of the eye pressure, especially early on after starting the meds.
How frequent?
It might be quite often initially. Then maybe once the pressure is stable, the vet will likely want to recheck every 3 to 4 months, something like that.
Okay.
It's also really important to keep monitoring for those potential complications we mentioned, like secondary glaucoma developing or retinal detachment.
So ongoing vigilance.
Definitely. And another important point, if only one eye was affected initially,
Yeah.
you have to be aware that the other eye is often at high risk of doing the same thing later on, especially with the inherited primary form.
Oh, right, because it's genetic.
Exactly. So in those situations, the veterinary ophthalmologist might actually discuss the possibility of preventative surgery on the currently okay eye.
To stop it from happening.
To try and prevent a future emergency, yes. It's a conversation to have with the specialist.
So it's really not just a one-time fix. It sounds like ongoing monitoring, maybe even preventative steps are key.
That's very true. Managing lens luxation often requires a real long-term commitment. Careful observation, consistent vet care.
Okay, let's try and bring this all together. We've covered a lot of ground on lens luxation today.
We certainly have.
What are the absolute key things you'd want our listeners to really take away from this deep dive?
I think the most important things are, 1, lens luxation is serious. It's not minor. 2, it can have both genetic roots and be caused by other eye issues. 3, recognizing those signs early, the pain, redness, cloudiness, maybe that wobble, and getting prompt veterinary attention is absolutely crucial because it can lead to pain and potentially permanent blindness.
So time is really of the essence.
Definitely. Getting an accurate diagnosis and starting the right treatment quickly gives your pet the very best chance for a good outcome.
That's a really clear and helpful summary. And it definitely highlights how important it is for us as pet owners to be vigilant and work closely with our vets.
Absolutely. Team effort.
On that note, here's maybe a final thought for you, the listener, to ponder. Given that we know primary lens luxation has that genetic link in some breeds, what potential role could responsible breeding practices play in the future, when it comes to maybe reducing how often we even see this condition in our pets?
That's a really significant question to think about, isn't it?
It certainly is. Well, thanks for taking this deep dive with us today into this really important topic.
My pleasure.
Until our next exploration here on The Deep Dive.